Over the years, I've had many opportunities to do outbreak investigations, and so I'm able to take the information that I've gained from those things to help try and prevent problems that come up. Well, influenza in the United States causes millions of cases every year. The influenza virus is a mess. This is a virus that basically constantly changes. And so that's why it's really important for us to monitor influenza closely, make sure that we can continue to update the vaccines to prevent disease, and also do surveillance to find any of these viruses that might be emerging that have pandemic problems or pandemic potential. We've also introduced a thing called next generation whole genome sequencing, which is a brand new way of looking at influenza viruses. We can find out about them more quickly, understand the resistance to the drugs much more quickly, and also help pick vaccine viruses more quickly. In addition, we're looking at technologies that we can take to the field so that we can send a team and figure out what's going on, identify what kind of flu it is, and then come up with solutions to help solve that problem. With these kinds of changes, we're able to have that influenza vaccine become available much more quickly. And so if you have a vaccine that has the ability to prevent millions of cases and hundreds of thousands of hospitalizations and tens of thousands of deaths, and if that's happening every year, that's grandmothers that didn't have to be hospitalized, it's kids that didn't miss school, it's deaths that didn't have to happen. And so that kind of thing makes it very easy to see that our work has a significant impact.
And now, please join me in honoring the winner of the 2019 Science and Environment Medal, Captain Daniel Jernigan. Yeah, congratulations.
Thank you very much. This is really quite an honor. Thanks very much to Secretary Azar for his kind introduction, and thanks very much to the Partnership for Public Service for selecting me for this award. Thanks also to Dr. Redfield, our CDC director, to Dr. Nastine Messonnier, our NCIRD director, and notably to Dr. Emily Labello Eisenberg for nominating me for this award. Thanks especially also to my wife, Stephanie, Dr. Stephanie Jernigan, who's here, our two sons, Chris and Tim, who have been so supportive for so many years, which really has translated into a number of trips and lots of phone calls when I'm not there. Thanks also to my dad for impressing on me the importance of making a difference. Over the last 25 years, I've been given the chance to work on a number of infectious diseases, and flu is by far the most challenging. It has a tremendous annual burden of disease. The influenza virus is also particularly problematic because it has the ability to rapidly change, leading sometimes to a severe global pandemic with the potential to cause millions of deaths. This award recognizes the work of many people at CDC and in the influenza division who are not afraid to jump into complicated situations and develop creative solutions. For flu, those innovations have contributed to averting thousands of deaths and tens of thousands of hospitalizations each year, avoiding illnesses that did not need to occur. Still, there is more we can and should do in surveillance and vaccine improvement to prevent influenza. It's an honor to be recognized, in a sense, for making something not happen. They say if we in public health do our jobs particularly well or perfectly, no one may ever know. For us, epidemiologists and laboratory scientists responding to emerging threats, our goal is the nurse in Taiwan who never got SARS, the faith healer in West Africa that never got Ebola, and for flu, the parents who never had to sit in their child's hospital room hoping for the best. So thank you very much for this award, and thank you for recognizing the dedicated people at CDC who are working every day preparing for and responding to emerging disease threats. Thank you very much.